Someone says, I don't know, I don't want to get ultrasound. It's just going to be too expensive. It's not worth it. How have you justified the the value or the cost of ultrasound and the training required and all of that?
Sure. So this was actually really easy because at the end of the day, uh, the direct primary care world is a lot different than the fee for service world because I'm not billing and coding. I'm not getting paid by insurance. So all of our office procedures are actually free. So this is an expense for the business that I, will continue to use for a long, long time. And your product, it has a very nice 5-year warranty on it. So I know that I'm getting something robust and that I'm going to be able to use it for a long time. But on top of that, the cost of getting a preliminary study for somebody that may or may not need it, or just that I just use that extra little bit of information to help guide medical therapy, is pretty priceless to me because getting an ultrasound, at least in my area, takes several days and is anywhere from $200 to $600, depending on where you go, when you go, who you go to. And that's through insurance. Trying to do it cash pay, I think the last time I saw was in the mid 150s, 180s cash price, and they're still a day or two out. My local place didn't have a tech, so they stopped doing ultrasounds. They used to do them only once on Fridays. So I mean, it's all about convenience and timing, and being able to get a diagnosis or a little bit more information earlier for me. So justifying it easy because I only have to do so many of these to really say the cost was worth it.
Yeah, and you're thinking about it too. It's interesting with your model. You're thinking about it, from your own perspective as a physician, but also from the perspective of the patient. Like there's a cost for them as well, and sometimes a fairly steep cost in time to make the other appointment, to go to the the imaging center, and then the added cost for that as well.